So for those of you who don't know me, I'm Madison Miller. I'm currently enrolled at Vincent University to obtain my bachelor's degree, and I currently work here on the childbirth unit at Memorial. In my final semester, I had to do a capstone project, and in this project, I developed a PICO question, which I'll explain later on in the presentation. But in all, it defines a workplace problem, and then we use statistical analysis on studies to find interventions to improve the workplace problem. Here in labor and delivery, we see a lot of hypertension. It's kind of been a common problem here lately. And in this presentation, I'm going to be talking about intervention to hopefully improve the problem. Will you click it on the drive? Will you point at you? I'm sorry. Just the space button. So the unit in question is an 18-bed labor and delivery unit, including our special care obstetrics. It's all in all. And Memorial's childbirth unit serves 15 different hospitals in 11 counties due to us being a regional referral center for Northern Indiana and Southwest Michigan. Again, the problem is that pregnant women that are not compliant with their blood pressure medications. And non-compliance is defined as the failure or refusal to comply. Unfortunately, I could not find specific statistics for our unit and as a whole, but according to the American Heart Association, hypertension during pregnancy is the second leading cause of death worldwide, which is pretty significant. Some negative patient outcomes that can occur with hypertension. For the mother, there's an increased risk of cardiovascular complications before, during, and years after pregnancy. As for fetal complications, it can include preterm delivery, small for gestational age, and a low birth rate. So one of the first studies that I analyzed involved medication compliance in patients with chronic conditions. It was conducted in 2020 and it was in Australia, and the purpose of this was to analyze the impact of medication adherence rates in adults with chronic conditions through a mobile app. The app was called Perks, and it involved dosing reminders for individuals, visual adherence feedback, educational tips, different incentives and rewards, earning points through gamification and different mini games, as well as a peer support group. That way they can discuss with other people about their diagnosis and their medications that they're being taken. And in total, with this whole study, there was different sub-analysis that they did in analysis. So they had a 6-month analysis that included 130 users, a 3-month analysis which included 243 users, as well as a timing adherence sub-analysis in which there was 111 users in 6 months and 221 users in 3 months. As a result, overall, the 6-month analysis, the overall adherence rate was 96.8% with a small decreasing trend that occurred during 4 to 6 months. The Friedman test revealed a non-significant difference in adherence rates over time, which resulted as a p-value of 0.505. In the 3-month analysis, the overall adherence rate was 96.6, which they had a small decreasing trend throughout the study. It was a 3-month study, so less time for them to do their medications. And likewise, the Friedman test revealed non-significant differences in adherence rates over time, which resulted as a p-value of 0.728. Overall, of the whole study, a benchmark of 80% for adherence rate, and it was met during the whole study. Additionally, in our second study, this involved analyzing medication compliance in patients with depression. And the purpose of this was to evaluate the influence of a mobile app on this to increase their medication compliance. The intervention include the in-person follow-up or through the mobile app to determine treatment compliance. And as for the control group, patients were just required to complete a form. And that's not very objective, it's very subjective, which is why it's the control group. But it was over 6 months. In total, there were 121 subjects, with 57 being in the intervention group and 64 being in the control group. And after 6 months, the intervention group had significantly lower rates of discontinuing their medications than the control group, with a p-value of less than 0.05, which is a statistically significant value. Overall, medication compliance scores resulted as a p-value of less than 0.001, which is a highly statistically significant value. Additionally, this was analyzing medication compliance in patients with coronary heart disease. It was conducted in 2022, and the purpose was evaluating the effectiveness of a mobile app using 2 different apps that can improve medication adherence. In the intervention group, this app provided mobile reminders and alerts for when they needed to take their medications. And as for the control group, this app just provided educational materials to promote rehab and prevention, nothing about medications and alerts and reminders for them. In total, there were 196 subjects in the study, with 103 being in the intervention group and 93 being in the control group. It was conducted between May and December of 2018. As a result, medication non-adherence scores decreased in both groups. But the intervention group showed a greater decrease than the control group at 60 days and at 90 days. And for the p-values, at 60 days it was 0.004, and at 90 days less than 0.001, which is a statistically significant value. And then additionally, this study focused on medication compliance in patients with hypertension. It was conducted in 2020 in 38 hospitals in the city in China. The purpose of this was to assess the impact of a mobile app on blood pressure control and medication adherence, but we're mostly just going to focus on the medication adherence scores versus the blood pressure control. The intervention was called the Yanfu mobile app. The sample size in total was 480 subjects, with 240 being in the intervention and control group. It was conducted over a year, from November 2017 to November 2018. As a result, the intervention group demonstrated a higher rate of medication compliance than the control group, with a p-value of less than 0.05. The control group using nothing, just to identify that. So back to the PICO question that I had mentioned earlier. PICO stands for, well, the P in PICO stands for population. I stands for the intervention, which the intervention will be the mobile app. C stands for current practice, which is not using the mobile app. And the O stands for the outcomes. So the following PICO question that I developed in whole was, in pregnant women taking blood pressure medications, how does the use of a mobile app to provide medication reminders, education, and peer support, compared to the current practice of not having that at all, affect medication compliance rates? So like I said, in current practice, we're not using it at all, which can lead to patients that aren't managing their treatment regimen, thus increasing the risk of hypertensive crises. An intervention that we can do as nurses and providers are included, but as nurses, we can perform better patient education. We can discuss the use of mobile apps to promote medication compliance. We can discuss how to use them, resources available, and results on other patients using these apps on medication compliance. The MediSafe Medication Management app is an app that I had looked up online before I come here. It is available on Apple and Android. It's a good resource that maybe we can start implementing here in triage, or even discussing with providers that they can use in their office. It provides some peer support, some education on the medications that are being taken, and it allows you to program your medications, the amount, and when to take them, and just a notification that'll pop up for you guys. As a change process to implement this intervention, I chose the PDSA cycle, which means to plan, to do, to study, and then to act upon. So for step one, here in our workplace, we can plan changes that need to be made regarding medication compliance, which we've identified patients just aren't taking their medications. And step two, us healthcare workers can implement the mobile app to their patient. We can provide education on it, and we can also assist in patients' programming. And step three, we can study and review if the intervention improved the problem at all. And then in step four, we can act. If the study worked, we can have full confidence that the intervention is going to work as a whole. As a unit, we can conduct a study. We can do a study over 6 months. We can talk with providers. We can have a control group, which would involve patients not using the intervention, and then the intervention group using the MediSafe Management app. And then over 6 months, we can decide whether or not it worked. So as a discussion, if everyone could kind of join in and get involved as well. For question one, do you think this intervention is appropriate for the workplace or feasible? Think it could work? Yes, the studies are involved with other patients that aren't relatable to pregnant women, but it's a population that can be used for all, so.
And I think designing like a flyer to hand out in triage, I think would be helpful.
Mm-hmm. Yeah. And question number two, how can the intervention positively and or negatively impact nursing care to the patients? Let's start positive.
If they comply to taking their medication, there's
coming in.
obviously increased risk to them and their babies.
Mm-hmm. Also thought that it might motivate the patients a little bit more if we have a plan for them and we're actually doing our part in helping them with the visual, we're programming it for them, giving them the education, it can provide just extra motivation for them and that we truly care about their well-being, because a lot of the times, you know, we're rushing patients in and rushing them out, not on purpose, but because we're busy all the time. So, negatively impact nursing care to patients? Anybody have any ideas?
I think the only negative to that would be the rushing.
Yes.
I mean, just lack of time, because
Mhm.
now you're adding one more thing that nursing would have to do to sit with them and help them.
Especially in
Potentially
triage.
program
Yeah.
and things like
Is
that.
the app free?
Yeah, that's something I should have mentioned, it is free.
Oh, okay.
And then, so question number 3, what are the positive or negative outcomes for us, the healthcare team in total? Positive.
Our patients are well controlled,
Mm-hmm.
it's gonna be so much better.
Yeah.
Less crises, healthier moms and babies.
I was more focused like on the acuity of our patients, you know, if they're in a hypertensive crisis, a lot of the times they get started on magnesium, and then that involves extensive fetal monitoring, multiple lab pokes, managing their magnesium, and looking at their labs, and just trying to have a safe delivery for mom and baby. There really isn't much negative about this intervention versus what you had talked about, just not enough time. Number 4, what are the barriers to implementing this intervention and how can we overcome them?
Well, if somebody didn't have a phone.
Exactly. So what you had said about making a flyer, we can also create like a template, monthly or something like that, where they can put on their mirror, on their fridge, bedside table, in their car, just as a visual reminder. Maybe it won't be as effective because you're not having a notification on your phone or something like that, but it's something that we can do in alternative to a mobile app if they don't have access to a phone or it's not a smartphone.
Or is the app bilingual or trilingual?
Yeah. Yep.
So,
Yep.
good.
And on the language barrier, a lot of us don't speak Spanish, and a lot of the times we don't have our in-person translators. We do have our language line overnight, which is a very, very good thing that we've got. It's a very good intervention for that, having a face-to-face conversation with the translator, but we still can't ensure that all information is getting translated over, so that's a barrier, but having that language line and in-person, face-to-face conversations will help overcome that as well. And number 5, who are the advocates that are involved in this intervention, and why would they be?
I mean, ideally, you would have your providers engaged early on, so hopefully, we wouldn't even be seeing women in triage, you know, for this
Hopefully.
issue, if we could manage it on the outpatient side with the providers.
Providers, us, the patient, the family. You know, it's not just the mother involved, it's the baby as well, so.
We probably would only see people that was maybe, even though they were taking their medication, just, the disease just.
Yeah,
got-
but even if a mom was taking their medications, they were compliant on it, and they're still having issues, this could also be a resource for us to evaluate, is that medication even working for them? Do we need to increase it? Do we need to change their medications? You know, a lot of the times with hypertensive crises, we can't avoid it. Like, they could be 100% compliant with their medications, their treatment regimen, which is, that's just an unfortunate case, but it can also be a step forward for providers to know exactly what's going on, for the patients in triage to know exactly what's going on, and for us to know what's going on, so.
Do they interact with the app and like indicate if they did actually take the medication when it reminds them? Do you know?
Like with the app that I had shown, there was like notifications on there. There wasn't an app, this was just studies that I had analyzed and like worked over. They didn't say that entirely, it was just looking at the compliance scores.
Okay.
But the app that I had looked at, that maybe I would start implementing in triage and stuff like that, or we all could, it definitely does have reminders and stuff like that, and then you can go, it has a whole score, like over time, if you're taking your medications, it shows you like a decrease in a bar graph and stuff like that.
Okay, so they are documenting if they actually take the medication?
Yes,
Yeah.
so that's why you can go, they can go to their provider's office and say like, listen, I'm taking my medications. I mean, you can say you took it and didn't take it,
Right.
but I'm hoping that with enough education on the risks and benefits and stuff like that, that we can actually have truthful patients and they are taking their medications instead of just saying it, so. Is there any questions that you're gonna ask?
Sounds lovely.
Thanks. it's kind of a step forward into maybe
Problem solved.
problem solving an issue that, I mean, I know working, everyone said like, wow, we have a lot of hypertension here lately. It's almost every person's getting induced for hypertension, or they're just having high blood pressure, so this could be, maybe be a step forward, you know, our no docs that come in, this, we could be the first step to that as well.
It could. Mhm.
Just a little bit of.
I think another thing is that it might be kind of a healing, we have a lot of people that are afraid of the health system.
Mhm.
And so if they came in and we were able to take some time with them and educate them, then they would feel maybe that this is more of a caring place that they could come, they would trust.
Yeah. That's what I'm hoping, you know, they'll give them motivation and just a heartfelt conversation with them as well. The only barrier to that is that there's one triage nurse to 5 triage patients, and sometimes overflow into birthing suites or pre-op, and, you know, we have our charge nurse, but charge nurse is also a resource for all the other floor nurses, so I think it's a teamwork thing that we could all do, and, you know, we have a lot of good teamwork here on our floor anyways, so it's just something that we can do to help our patients a little bit more.
Very interesting. Good job.
Kate, do you have any questions? Or Molly, or anyone?
There's a few of them.
I don't, very good, I like the idea.
Thank you.
No questions here, I just wanna say it's a great idea, and I think, it would be a really cool thing to implement.
Awesome, thank you guys. Alright, well, thank you all for coming and attending.